Here at Mid-Maine Medicine, we recently had 6 patients complete the first 16 weeks of the National Diabetes Prevention Program offered through the Prevention and Healthy Living Department. Their successes will speak for themselves and will speak to the benefit for proactive outreach. But first, I will take a moment to tell you how we got this wonderful program started. We were fortunate enough to have on staff an RN care manager with a passion for diabetes education who was already a life coach for the diabetes prevention program. So the next step was meeting with the staff from Prevention and Healthy Living. The partnership with Prevention and Healthy Living was instrumental. They have many of these projects in motion, so their expertise in helping us find the option that would fit our practice was key. Here are the steps we did with Prevention and Healthy Living. We met and developed a plan and timeline with Prevention and Healthy Living staff. We then reviewed the patient list that met criteria. The original list was 163 patients. Our practice staff scrubbed the list down to 75 patients who could benefit and commit to the entire year. We then developed an outreach letter explaining the program. That letter was mailed to the eligible patients, which the Prevention and Healthy Living staff took care of. Lastly, our trained lifestyle coach on staff made follow-up outreach calls to the patients who received the letter. The follow-up call is important to start building the relationship with class participants, so we wanted the life coach, our RN care manager, to help with those. However, the Prevention and Healthy Living staff made some calls and would complete them all if needed. The Prevention and Healthy Living also provided scripting recommendations based on their experience with calling patients to our staff RN, which was helpful when making calls.
Then it was class time. The big takeaway is proactive outreach with your patients, and in our case, a class in our office was successful. Instead of waiting for our patients to have a provider visit, we were able to look at the risk population and target them for an evidence-based program. This is our attempt to start managing our population and focusing on preventing disease, and it worked. From the 10 patients that attended the first class, 6 of them have completed 16 weeks, and here are their results thus far. 5 of the 6 remaining are our own patients. They've lost a total of 111.2 pounds. The goal is to have at least 150 minutes of physical activity a week. They are averaging 430 minutes of physical activity per week. This is excellent because the CDC tells us that a 5 to 7% weight loss can reduce or delay the chances of getting type 2 diabetes by 58 to 71%.